I'm here with Dr. Lisa McKay-Brown, Senior Lecturer in Learning Interventions here at the Melbourne Graduate School of Education. Thank you very much, Lisa, for giving me the time for this interview today. My first question is, what makes mental health and disability important areas in research and policy?
So I think the reason that disability and mental health are really important areas of research and policy is because pretty much every teacher is going to have a student with a disability or with mental health disorder or both in their classroom at some point in their career. We know that about 20% of young people in classrooms have a disability, a diagnosed disability, or some other form of additional learning need. And about 1 in 4 young people are likely to experience a mental health illness, a mental illness, during their school years. So when you consider that's a quarter of your class and a fifth of your class who may have some form of disability, it's really important that teachers have an understanding of how to support these young people and how to give them the best education that they can. In regards to policy in particular, the young people with disability are protected under the Disability Discrimination Act and the Disability Standards for Education. These two documents have been developed to ensure that young people with disability, and that includes young people with mental health disorders, young people with disability have a right to access education on the same basis as any other young person in school settings. These young people in particular are supported by these documents through access to what we call reasonable adjustments. So this means that a young person with a disability who has the need for slightly different programming within their classroom environment or school environment is under law required to have these. So that includes allowing young people with disability access to enroll in a school of their choice. It includes making sure they're consulted around adjustments made, that they're able to participate in school on the same basis as everybody else, that the curriculum is planned according to their needs, and also that they're protected from bullying and harassment. So those particular legislative and policy documents or guidance documents really protect young people with disability. So that's one area in which these young people are seen as very important, and understanding that these young people are at risk. So we have these policies in place and this legislation in place. I think with research as well, it's the areas that are important to look at is what's the best way to provide these adjustments for young people. What are not only their academic, but their behavioural and social emotional learning needs in schools. And research needs to investigate this, but also needs to come up with really practical examples of how teachers can access this and use this in their teaching.
And what are some of the insights from your own research work in the areas of disability and mental health?
So my particular interest in this space is working with young people who have mental health disorders. So my teaching experience is working with these young people in hospital school settings. And the areas of most interest for me are working with young people who have complex behaviours of concern, but also young people who are disengaged from schooling. So young people with mental health disorders may be at risk of exhibiting behaviours of concern, and they may be at risk of disengaging from school. So at the moment, my focus is really on the young people who are disengaged from school. They fall into a particular category of school attendance problems called school refusal. So there's a range of different types of school attendance problems, but the focus of my young people is school refusal. So this is where they can't go to school rather than they won't or don't feel like going to school. They just can't go. Their mental health needs and other functional and family factors that are happening for them means that getting to school is really hard. There also can be school-based factors. School might be just a really scary place for them to be, It might be they feel like they don't belong. It might be they feel they've been bullied. They can't access the academic learning. Or it might be that they really can't cope in the environment when they're expected to perform. So when they're put on the spot, when they're called on to ask questions, when they have to be part of a sport team, things like that. So there's a range of different factors that can lead to school refusal. So the young people that we work with in the research that I'm doing at the moment, it's a project called Interschool, is that we focus on getting these young people back into mainstream settings. We know that these are young people who don't need to be put in segregated, special or alternative settings. They are capable of remaining in mainstream settings when they have the right supports. So we have set up what we call a transitional classroom, where the young people come for a period of 10 to 12 weeks. And in that time, they're being given individual therapy for their mental health needs by a clinician, but they're also getting education supports with teachers. And what happens is the teacher and the clinician work in partnership to ensure that the mental health work being done with the young person is transitioned into educational responses. And also what the teacher is learning about how the young person focuses in the classroom, they're able to give this information to the clinician so the clinician can set up therapeutic interventions that help the student through those different times. So if a student's feeling really anxious and not coping in the classroom, there'll be different strategies that that young person will have. I think one of the great things about Interschool, apart from the fact that our kids are going back to school and staying at school, is that their mental health recovery is really improved. But it's also the psychoeducational, the work that we're doing with teachers in the schools they go back to, and really skilling these teachers up in what school refusal is and how to work with these young people. When we talk to the young people themselves, what they're telling us is they need to feel like they're in a safe school environment. They need to feel like they belong. They need friends. That's really important for them. They need to feel like they've got friends, but they also need a really positive relationship with teachers. And the other thing they need is an understanding about their academic needs. They need teachers to understand when they're not coping, and they need teachers to be able to respond appropriately to support them to stay in the school setting.
And what do you think are the emerging areas in research and policy in relation to disability and mental health?
So I guess that for those of us who work in disability or with young people with disability, the biggest area of discussion, contention, research, one of the biggest areas at the moment is that of inclusion or inclusive education. Internationally, the United Nations, under the Sustainable Development Goals, have made it really clear that young people with disability have a right to be educated in inclusive environments, that is, mainstream environments, and that we need to be working internationally to support this to happen with young people. So in Victoria in particular, this is an area of focus for the Department of Education and Training. There is an inclusive education branch, and that branch is really looking at how we can support young people with disabilities, not only in their special settings, but in inclusive mainstream environments. So the policy is very much looking at how we can support students and families to choose schools they want, to support teachers in how to best implement the disability standards for education, and also how to understand the way that we can adjust curriculum for students. So I think definitely policy-wise, inclusive education is the big one. And there's been a lot of research in this area that shows that young people with disability in inclusive settings often have better academic outcomes, better social, emotional learning outcomes than they do if they are in other settings. So we know the research is telling us that this is the case. We just have to get better at enacting it and having it actually happen. But for that to happen, a lot of different supports need to be in place, not only for the student and the family, but also for the staff in those settings, so that they're able to provide the best environment for all of their students, including those with disability.
My next question is about the role that teachers can play in addressing some of the inequities that might arise from, take, say, disability or mental health problems.
I think firstly that teachers need to understand that young people with disability are at increased risk of certain things, and that is not achieving academically, being at risk of bullying and harassment, and also being at risk of having not as great social connections as other kids. So I think for teachers initially it's to understand that young people with disability have certain risk factors, or can have, they won't always, but may have certain risk factors, and teachers are some of the best placed people to provide the protective factors for those young people. So if the teacher has an understanding of how to assess young people and understand what their needs are, then they're better able to program and plan for those young people. So, while having an understanding of the particular disability that the young person has is really important, the disability doesn't tell you everything you need to know. And that's why we need to go back to knowing the young person. So first and foremost, knowing the young person, and also involving their family in the work that you're doing, getting information from the family about their child, because that can really help you when you're making decisions about what you need to do. So I think for teachers, it really is about knowing the young person, understanding how to assess the needs of that young person, and then being able to make appropriate decisions about how to support that young person, not only in the classroom but in the broader school community.
And what would be your advice to a teacher who's beginning their career and who might have students with disability or students with mental health problems?
So for teachers, early career teachers, I think some of the most important things for them to understand is how to use multi-tiered systems of support for young people with disability, and actually all their students, not just young people with disability. Understanding about the universal interventions that they can put in place in the classroom for all students, but these will also particularly target students who have additional needs. Understanding when additional supports are needed at the secondary level and individualised supports at the tertiary level of the intervention triangle. So at a universal level, some of the really, basic things that a teacher can do is they can make sure they have really clear expectations in their classroom. So what will the students do, not what won't they do. So very much always couched in the positive, but these have to be explicitly taught. Students don't just know how to do things. Even there are students in secondary school who don't know how to put their hand up. So we have to teach those skills. So explicit teaching of expectations is really, really important, because if you haven't taught what it looks like, how do you expect somebody to do that? I think having really good routines and processes in your classroom so that students understand what the entry and exit routines are for the classroom. How do we collect materials? How do we work in groups? So really having clear routines about those different things, because if your classroom is feeling safe for all students, that's going to make a difference, not only for students with disability. The other areas too, I think we need to understand is how we use our physical and non-verbal cues with our students, how we can teach them what we need just by signals and looks. Those sort of things can be really important for early career teachers, because if you've got a student over the other side of the room that you need to communicate with, you're not going to necessarily yell across the room, not always the best way to go. But if you've got cues and signals that the kids understand, then that can be really helpful for managing that particular classroom space. So I think really that focus on how do we manage our classroom spaces and how do we set up conditions so that we can best do that is really important when we're working as early teachers and also really experienced teachers. Using visual cues in the classroom for me is really, really important. A number of young people we work with will have speech and language and processing disorders or difficulties, and so much stuff happens orally in classrooms. We need to supplement oral information with visual information. So if we're got a set of instructions that we need students to complete, or a set of steps in an activity, put visuals up for every one of them. You know, even you can put little, you know, markers next to it as students should be at the next stage. Those sort of things support those young people who, you know, might be looking around the room and not on task because they actually don't know what to do. It's not that they're being oppositional, it's just they really haven't picked up those oral instructions and they really don't know what they're meant to be doing. Then they're the person that someone sees and goes, hey, why aren't you sitting down? You know, that sort of thing. So I think visual supports are really, really important as well. So yeah, having a really good look at universal strategies for the classroom, and at a planning level, having a look at universal design for learning. That's a really good research-based planning tool, which allows you to look at the needs of all of your students and then ensure that as you're planning your curriculum, you're providing instructions, materials in a way that everyone can access, that you find different ways to engage students in the task, but also that you find different ways to allow students to express what they know rather than a one-size-fits-all approach, because that doesn't work for students. It doesn't matter whether they have a disability or not. Students need to be able to express their learning in different ways. So for me, I think they're some of the key things for early career teachers.
Thank you very much, Lisa. It has been a great pleasure talking to you today.